We're really proud of with our telehealth program is working with our partners, our clinics that are our contributing partner clinics, and also our community partner, Clark. It's a mental health center in Monette, Missouri. We have 10 contributing clinic partners, and they've been really good to work with, accommodating and eager to learn about the program, receive education on the program, and then also share information with their staff and providers.
So I would say, for me, as I get to schedule and reach out to patients, it would be being able to reach out to the patients that are in our rural communities. There's a big need for behavioral health care, and I just feel really proud that we've been able to get more and more patients on board and having them receive the help they need.
When we completed year one, we had a total of 146 unique patients go through the program with the total number of telehealth encounters or appointments completed have been 273, and it's just increasing since then. This project is a little bit different where the patient can connect directly to a distant provider from their home. So we have Microsoft Teams set up, has an organization. So we've been lucky where we don't have to do a lot of workflow related to the technical aspects of telehealth. It's all set up. We just do minor things such as adding the clinics where we can schedule the patient and tie them to a clinic, and then from there the provider is able to join the patient, is sent email reminders, and this all Terry that does that behind the scenes. It's a lot of work.
The early on tips and learning with the whole program is just to always keep communication with all of your clinics and your providers, and always just throughout the years, I've learned even just reaching out to them occasionally because they are so busy that sometimes they forget that we're here and we have this service available to their patients. So it's always just a good thing to just keep in touch with them consistently.
In terms of sharing something with the other grantees, I think just being flexible. Sometimes what is written down it doesn't necessarily happen the way that it's written down, but then real life comes in where, working with real life partners, real life clinics, real life patients. So just be flexible. One thing that's really worked well for us, especially with the first project, is to anticipate challenges and think of solutions, and then not be afraid to go back to the drawing board and then try something else, in order to fulfill the objective, the activity. It may just be in a different way than what you had originally thought or written down. So just be flexible, adapt, and anticipate challenges. Those would be my tips to other grantees. So this program definitely fits into that, the larger community health improvement initiative by really bringing access to patients and clinics about the multiple services that are available. In addition to behavioral health care through telehealth, there are several chronic disease management services, and as well as community health worker services. Those can all benefit patients in different ways. And so bringing awareness to that is a big goal of this project, because sometimes clinics, they're just so busy with with the patients and providing care to them. And this provides a different level of continuum of care, if you will, a more integrated care, where we're leveraging services that are already provided within the system, as well as outside in the community, additional mental health services. So it encompasses all of that to help improve community health in the surrounding area as a whole.
So originally, a patient would come in to the office and do their telehealth visit in the office. So that really helped a lot too, because we were able to sometimes piggyback appointments so that the patient didn't have to come into the office twice. They might have a visit with their provider, and then they could follow up then with the visit with the behavioral health, provider. So there was that, and then again, like Shameen said, the transportation in all of our clinics is really an issue. So it really did help a lot. And there were people, I think, that probably wouldn't receive the behavioral health services just for those issues. They can't get to Springfield. And so that's kind of the last thing they think about is their mental health, you know. So it's been a great service to us.
When the pandemic hit, our previous project was mainly focused on providing telehealth for behavioral health services in person, meaning the patient goes to their home clinic. But at that time, there were several limitations where only certain type of appointments were allowed. And since, mental health, is a little bit different than physical health, these were not considered like essential sick appointments, if you will. And so we saw initially loss of appointments at that time for our provider, as clinics were becoming more limited in their services, just so they could better prepare for what could be happening, as the pandemic moved on. And so one big adaptation that we did, with the approval of HRSA was to move all appointments from in-person to virtual so that patient can connect from home. And that's where the Microsoft Teams came in. We leveraged that since the organization moved to that platform. We wanted to do the same with the program as well. And, we've brought that in with this project where it is completely DTC, direct to consumer care.
Pandemic kind of really brought a bigger awareness for mental health. A lot of people were suffering just because of the pandemic too. So it kind of forced us to do this transition, and I think everybody was a little nervous at first, but we had to do it. We took it and we ran with it, and I think it's been the best thing overall for all of our patients. And like Shameen said, sometimes patients have to wait like months to get in, and this makes it much more flexible. Sometimes our counselor can serve as a bridge while patients are waiting to see someone at, say, the Clark Center. But they'll have, right away they can get with Daryl, and he can be that bridge for them and talk with them before they get their permanent service at the Clark Center. So it's been a pandemic actually helped us in a way, I